For more on this unfolding humanitarian crisis, let me turn to Rami Shamma. He's the operations director at World Vision Lebanon. Rami, I know your organization has been involved in helping people who need food and shelter. Talk about what the greatest need is right now.
If you want to look at it, hello Asia first, and if you want to look at the scale of the humanitarian crisis over the course of the 11 last months, there was around 100,000 displaced. Now the numbers have reached around 1.2 million, out of which 160,000 reside in 900 plus shelters. And these shelters, we're looking at schools that have been utilized to welcome the displaced. The most urgent needs at this stage are the basic needs. We're talking about mattresses, blankets, hygiene, and food support.
What's the situation at hospitals? We understand a number of them have already shut down.
So in general, this escalation comes at compounded crises that are present in the country, one of which is the healthcare system that is not able to absorb this level of cases and the number of medical cases that would be required as well in case this situation lasts longer. We're looking at also medical problems happening in the shelters, as well as the lack of access for people to be able to move and to be mobile to those hospitals.
Rami, how much of a challenge is it to get aid to the people who need it most when Lebanon is being bombed?
I'll give a very small example. We've had several of our colleagues within World Vision who were trying to get to the shelters to be able to provide either hot meals or food assistance or any kits or any other assistance, and the bombs and the strikes were actually happening meters away from them. I mean, this is a risk that us humanitarians take on a daily basis.
Are you worried about your own staffers getting hurt?
At all times, and every strike that we hear about, we call in to check in the safety and the security of our staff. And even staff are sometimes within their houses. They are being the strikes are happening next to their houses as well. So the safety and security is a continuous fear and concern for us as an organization.
Rami, with so many people displaced, I understand a lot of them are going to Syria, but the ones who are choosing to stay in Lebanon, where are they going?
So either in shelters, as I explained before, or to different houses that are present across the country. So we're looking at displacement even reaching to Akkar, which is the farther north of the country, and many people who showed solidarity with the displaced, they offered some of the houses for free, and then there are people who rented those houses. So the 1.2 million who are displaced are, divided into different places, from shelters to different houses, but across the whole country. Some of them even have been displaced twice, and some of them are still looking into relocating to different types of shelters as well.
Rami, talk about the children. How do you explain this conflict to the kids?
The kids, honestly, I would say they are the most impacted by this crisis. We're looking at around 300,000 displaced, but even before the displacement, the children who were living in the south were, for the last 11 months, have had their lives disrupted. I can speak about one of my visits to the shelters last week, where we experienced a sound barrier just above the shelter, and it was quite heavy. The children started screaming, they started running around, the parents, especially the mom, started trying to flee for safety. So imagine going out of the conflict, going to safety, but then even the safe place that you have tried to reach is not safe anymore. Needless to say that those 300,000 who are displaced, but also all of the children in Lebanon, they have their education disrupted because, one, the schools that are being utilized to be shelters for the displaced, but also look at the connectivity issues, look at the logistics, look at the mental well-being of a child, always hearing the voices of the bombs and the sounds of, and the fear of their, yani for their lives and the lives of their beloved ones as well.
You know, what you're describing is also what we heard from so many of the aid workers dealing with the children of Gaza. And I guess my last question to you is, how concerned are you as a Lebanese that your country could potentially turn into another Gaza?
I'm very concerned, honestly. Speaking as a Lebanese and as a person from the South as well, and a father, I'm very concerned for the situation to last long and have a bigger impact on our lives and the lives of our children. And needless to say that we as, humanitarians, we try to support, we try to intervene. I mean, World Vision has been from the conflict, from the start of the conflict on the ground. We've escalated, with the escalation, we've expanded our programming. Now we reached around 90,000 individuals with different services, as I described earlier. But the more the crisis continues, the more the more it hurts, and the more the wound, grows deeper. And I would say the more recovery we would have to do, and the more work we would have to do in the recovery phase to be able to get people out of the war, but also to rebuild the lives and the livelihoods that we have invested so many years in over the course of the last years.
Yeah, and I can hear the emotion in your voice. We really appreciate you joining us and talking about this important angle of the story. Rami Shamma, thank you.